Our project starts from the idea that with the development in drugs for Alzheimer, disease-modifying therapies for Alzheimer disease, we need to look at the optimal population, the target population for administration of these drugs. So subjective cognitive decline is now considered as the earliest phases of this neurodegenerative diseases preceding MCI, mild cognitive impairment. So should be an optimal target population to administer disease-modifying therapies before neurodegenerative process starts. But on the other side, SCD is also a very common condition and a very heterogeneous condition with many possible underlying causes. So we need globally scalable and easily accessible tools to screen patients, to identify that individuals that will develop Alzheimer's disease during their life, to administer disease-modifying therapies as soon as possible, but also with avoiding to including individuals with other neurodegenerative condition or other neurologic disorder. And now currently we have these tools that are emerging, that is artificial intelligence, in particular machine learning, that help us to elaborate a huge amount of data altogether, helping us to also to understand non-linear relationship between data and outcome, so to identify which features, clinical, demographic, and every kind of features can be predictive of future development of dementia in this kind of population. And this is what we are looking, we are trying to do with this project that is called Preview, predicting progression to Alzheimer's disease from subjective cognitive decline with machine learning. And we are including hundreds of patients with subjective cognitive decline that have been assessed with neurologic examination to explore clinical demographics and genetic features, neuropsychological examination, extensive neuropsychological examination, assessment of cardiovascular risk factors, of personality traits, and mood disorders. And we are using all these features to develop machine learning models. We are using different algorithms, trying to find the best algorithm to be applied in this case. And what we are finding now is that machine learning can be accurate to discriminate between patients that will remain stable, that will remain with subjective cognitive decline for many years. We have a follow-up time of 14 years on average, and we are our first result that this method can be applied to this aim. Our second aim that is possible thanks to machine learning is also to identify which feature is most important in this model, so we can understand which features should be considered at baseline, which features have to be considered by neurologists to select patients, to understand which patients need more attention at baseline, rather than patients that can be followed up with a different approach, not looking for the neurodegenerative disease. At the moment we are getting different in performances depending of the feature we use and depending on the model we use, but on average the range of accuracy is going from 70% to 80%, so it's not a very good accuracy at the moment, but we think that with the But first of all, we have to disclose that this is one of the first one of the first time that we attempt to use this kind of method to this population, to subjective cognitive decline, because we know that machine learning and other artificial intelligence methods have been applied in medicine, but so far we don't have we are not aware of this application of this method in subjective cognitive decline. And so we have to, I want to highlight that this population is a very early population, so we are looking to patients that will develop Alzheimer's disease maybe after 15, also 20 years, so we think that this could be considered an accuracy with this range from 70 to 80 could be considered not bad for this kind of population, but we also think that that improving our models, also selecting the features that are more predictive, can help us to improve, also including other features, because at the moment we are only including clinical, demographic, and features that can be easily assessed also in a primary setting for memory assessment. But we are not considering, for instance, some biomarkers that can be also easily applied, like blood-based biomarkers, and we are implementing our project doing so. And we also want to change the outcome of our model. At the moment, we are looking at the conversion from subjective cognitive decline to dementia, but we want to look at the pathological condition underlying this underlying subjective cognitive decline. So classifying patients based on CSF biomarkers, and this is the second point of this project, because this is one of our main aim, because at the moment there is no shared protocol to suggest to help clinicians in managing of subjective cognitive decline, and this is what we are trying to do. So, as I said, selecting features we could be able to design a proposal for an algorithm to be applied in a clinical setting, so suggesting which features. Now, at the moment, our data are with our data at the moment we are able to say which features should be considered at baseline, so which features at the first evaluation of a patient with subjective cognitive decline should be considered at baseline, and which features should be considered during the follow-up to understand if a patient is going to understand which is the trajectory of the patient, if it's going to worsening of their cognition, or if they are going to be stable, or also to reverse to subjective cognitive decline.